Coming up on this special This Just In, we celebrate Veterans Appreciation Month. Stay tuned. Good afternoon, everyone, and welcome to This Just In. I'm Bramante Bryant. This is Veterans Appreciation Month, and today we have a special edition of our show solely focused on veterans issues. We'll start our program with my interview with Dr. Adam Robinson, Jr., the 36th Surgeon General of the Navy. I asked Dr. Robinson what it means for our nation to honor past and present military service members and their spouses. Dr. Robinson, talk to us about Military Appreciation Month and what it means for the nation to honor present and past military service members as well as their spouses.
Military Appreciation Month is a time when our country can look at the men and women who are wearing the cloth of the nation and to their families and say thank you for a job well done. Our men and women serve in our armed forces. We don't get extra pay. We go into harm's way. We're not really looking for recognition. But this time of year, it's a time when we can really look at these men and women and say thanks and just give them a helping hand, give them a handshake, give them the appreciation that they deserve. So Military Appreciation Week and Month is something that our men and women look forward to, particularly during this very tense time of COVID-19 pandemic. It's something that it's another way that we can honor them and help them.
Dr. Robinson, during your military career, you've been responsible for the health care of Navy and Marine Corps service members as well as their families, a lot of responsibility. But you found time to participate in humanitarian efforts, especially in disaster areas. Talk to us about the importance and your stance on social responsibility.
So military medicine not only does the kinetic aspects, that is the hot parts of war, and also trauma surgery and all of the things that you may have seen on, for example, shows like MASH. We also do humanitarian assistance and have for many, many years. All the services, Army, Navy, Air Force, reach out and we can send med reps, we can send hospital ships, we can send the men and women in uniform to different areas in the world and help in a variety of different ways, with vaccine programs, with physicals, with trauma, with medical support, with all sorts of different areas, including, and very fundamentally, many of our research laboratories. In the Navy, we have several Navy medical research laboratories in Asia and in Africa, where we do primary research with tropical diseases and diseases of the area. So humanitarian assistance is a foundational stone of military medicine.
It is important to note that you have served as the 36th Surgeon General of the Navy. Currently, you serve as the Medical Center Director at the VA Maryland Healthcare System. Talk to us a little bit about the highlights of your past position and your current position.
So the highlights of being Surgeon General, and that was certainly the pinnacle of my active duty career, and to be the representative, the Navy medicine representative for the Navy and the Marine Corps, to go around the world and to be involved in all sorts of medical diplomatic activities, to be involved in making sure that our men and women were safe and out of harm's way, and if in harm's way, could be cared for and could be made available the absolute best in trauma care and in medical care. These are the things that really stand out for my active duty years. As I transitioned to the VA, it was a 360-degree transition in this way. Coming into the VHA, the Veterans Health Agency, I have been able to continue to serve and to care for men and women who have worn the cloth of the nation, just like I did as Surgeon General, men and women who were wearing the cloth of the nation, and to make sure that our country honors the pledge that we have made to our service members to care for them throughout their careers. And the VA helps me to do that. It's been an absolute honor and a pleasure to be affiliated with the VA Maryland Healthcare System in Baltimore, but also VA in general.
Of course, these are challenging times right now with the COVID-19 pandemic, and as the director of the Maryland VA Healthcare Center, What are you sharing with staff there to keep them encouraged during these times?
It's important to make sure that people recognize that we are in this all together. So I'm in my office here at the VA Maryland Healthcare System. As you can see, I'm not wearing a mask, but when I leave this office, a mask goes on the face. We have to make sure that we send out a consistent message and that that message is based upon science and upon empirical data so that we can keep ourselves safe and we can keep our patients safe. The key to medicine and the key to what we do is to be very consistent and to be very transparent in the information that we present. We have to be consistent and we have to be persistent in sending that information. And we also need to make sure that the information we're sending has been properly vetted and is based not upon what we feel, but what actually will make a difference in our patients' lives and in our staff's lives. I want the men and women here to know, and our patients to know, that we will stand with them every day in every way, and we are here no matter what. We have changed a lot of our modalities of treatment in this regard. We now have a lot more virtual clinics than we've had in the past, but we're finding that that works quite well, and we are still available to our patients.
And Dr. Robinson, what can you share with our viewing audience about what they can do to prevent the spread of the coronavirus?
I reviewed data from the 1918 Spanish Spanish flu pandemic, and it's interesting. A lot of the social distancing and a lot of the things that we learned a century ago, we should still do today. Very quickly, wear a mask when you're out, socially distancing from people 6 feet at least, washing your hands frequently. These are all things that make a huge difference and that can, in fact, help to reduce the spread of COVID-19. By the way, mask is not just a way to keep from getting COVID-19, it's also a way to keep from spreading COVID-19. One of the interesting things about this particular virus is there are asymptomatic carriers of this virus who do not have symptoms, but who could give that virus to other people, and it could be fatal. So it is our social responsibility and our humanitarian responsibility, and actually our moral responsibility, to be very consistent in what we do and in making sure that we do those things that make a difference. Wear a mask, wash our hands, and socially distance ourselves from others.
And in our final moments, Dr. Robinson, we do know, as we mentioned, it's a Military Appreciation Month. Do you have a message of appreciation and hope for those serving near and far?
Everyone in the country has benefited from the men and women in our armed forces because everyone in our country has been able to maintain their lifestyle, to maintain their freedoms. Our abilities to get out and to do anything that we would like to do is based upon our military's ability to be there and to care for us both at home and overseas. I want to send my thanks to the men and women who have sacrificed themselves to make that happen. And they have sacrificed themselves willingly, not for money, not for pay, because they believe that honor, courage, and commitment are important, and that our government and our Constitution stands for not just any one person, but it stands for the United States of America.
Dr. Adam Robinson, thank you so much for joining us. And again, thank you for your service to the nation and to military veterans.
Thank you very much, Bramante. It's been a pleasure to be here.
For more information about Dr. Robinson and local resources for veterans, please log on to dcw50.com and washingtondc.va.gov. Well, Nurses Appreciation Week recently wrapped up. Our gratitude to nurses, of course, extends beyond that designated week. We have the Chief Executive Nurse with the DC VA Medical Center coming up next. Welcome back. Our salute to veterans continues here on This Just In. Nurses are among the heroes of our community during this coronavirus crisis. I spoke with Denise Boehm, Chief Nurse Executive with the Washington, D.C. VA Medical Center, about encouraging her team of nurses on the front lines of the COVID-19 pandemic. Well, Denise, you are the Chief Nurse Executive at the DC VA Medical Center. You're one of the leaders of the COVID-19 Incident Command Center, so you are on the front lines. But talk to us about what you're saying to your nurses and the staff there to encourage them during the COVID-19 pandemic.
Hi, thank you. Coincidentally, all of this is happening and really coming to what we would call a peak surge during Nurses Week. So this week, starting May 6th, begins Nurses Week. And every year, both the American Nurses Association as well as the World Health Organization have a theme for Nurses Week. And because 2020 would have marked the 200th birthday of Florence Nightingale, the World Health Organization declared the entire year of 2020 as the year of the nurse and the midwife. And who would have ever been able to predict that when the World Health Organization made that declaration, the world would have needed nurses as much as they did in 2020. So, with that, we are talking to our nurses and communicating to all frontline staff more than ever. And typically during Nurses Week, which starts on May 6th and goes through May 12th, we would simply say Happy Nurses Week and just do some ceremonial gatherings. But this year, it's so much more meaningful. So I'm telling the nurses that they are heroes and that they are role models, and telling them how amazing they are, how indispensable they are, not only to our patients, but to each other, and telling them all thank you so much for everything that they do every day.
And Denise, part of what they're doing, specifically too at the medical center, but in hospitals around the area, they're working long hours willingly. What's your sense of what is motivating nurses to go beyond, above and beyond?
I think something that is unique to nursing is that we provide very holistic care. So we're taking care of the medical needs of our patients, but also the spiritual needs and their personal needs. So when you look at it in that fashion, it's more of a vocation than it is a job or a career. Nurses who are passionate about what they do really feel calling to the work and the care that they're providing. And I think that is something that really motivates them to step up and to continue to give back and go above and beyond. We have seen nurses who have really rallied and pulled together to support each other, to support their communities, to support our sister hospitals. And it's been so wonderful to see how they are taking care of each other during this time as well.
And would you consider that sort of a passion for their profession? Would that be a good way to describe that?
Absolutely. They are extremely passionate about what they do. And it shows in the types of care that they're providing.
Now, the DCVA Medical Center, it is a federal government hospital, right? Solely operates to care for veterans and military personnel. We've mentioned before, but it's worth mentioning that May is Military Appreciation Month. Have you seen an uptick in community support as a result of this observance during this month?
We really have. We have seen so much support from the community, both in seeing notes of thank you. We are seeing people who are worried about the healthcare team and the healthcare providers. So they are donating things like hand-sewn masks. They are making us protective equipment with their 3D printers and donating them to us, sending meals to the frontline staff who are here every day. There has been so much community support. There's also been support from VA leadership and from the DC Hospital Association. So we're seeing support both from the community, but also the partners that we work with. It's been fantastic.
And how about you as the Chief Nurse Executive? How have you been dealing with all that is going on, especially with COVID-19 during this time?
I I too, like the nurses that I work with, find this more of a vocation and a calling than I do a job. And I truly feel blessed to be working here at the DCVA because I have never worked for a more professional, a more dedicated, and a more caring team of not just nurses and doctors, but everyone who is here every day to support the care of our veterans.
Denise Bain, Chief Nurse Executive with the Washington, D.C. VA Medical Center. We thank you so much for joining us. We thank you for all that you are doing, all that your staff is doing, and we wish you all the best. Thank you so much.
Thank you for your time.
We encourage everyone to honor our local nurses. Check out dcw50.com/nurses among us. Coming up next, a well-known DCW 50 personality recalls how his service in the Marines shaped his life.
We have Steve Wilkos here on DCW 50. And first of all, I know you work with your wife. She's the producer of your show. And with everybody social distancing and having to stay at home, you're used to working with your wife and being with her all the time. Has that helped you in the time we're all supposed to be home?
You know, it's funny as far as what's going on with the coronavirus and the quarantine. My life hasn't really changed. We finished taping March 11th, and when our season is done, we go on hiatus. So I'm home a lot, and other than and instead of maybe doing this, there'd be trips that last summer I'd go to either Philadelphia or Washington. I'd go to Chicago, Tampa. I would go to places that my mother's in Tampa, so when I do station visits, I enjoy doing those things. But other than that, I'm at home. My wife is actually battling breast cancer right now, so we're being extra cautious because of the chemotherapy. Her white blood cell count drops, so we have to be extra diligent that so nobody comes in my house. We don't go anywhere. Anything that comes in the house, I wipe down with disinfectant and gloves and everything else. So that part, but being home with my wife, and the only other thing that's really different is my kids. They're teenagers, so they want to do their own thing, but now they're forced to spend some time with mom and dad.
Well, what are you guys doing for fun?
You know what? We put a ping pong table. Actually, if I tilted my computer, you might even be able to see it over there in our kitchen over there.
Very
we got
nice.
A ping pong table. Yeah, so we've been having a lot of ping pong tournaments, and I actually, we moved into this house last year, and I put a nice gym into the basement. So I've been living in the gym. I've been working out and really just spending a lot of time doing that.
Well, Steve, I know that you served in the military. You're a Marine. And first of all, thank you for your service to our country. And as we're in Military Appreciation Month, I've seen on your show for 13 years how you deal with guests and you deal with people on your show. Do you think your training in the military helped you on your career path into being a talk show host?
Being in the Marines made me who I am, period. I attribute all my success, all my hard work, my work ethic, by being in the Marines. People, when I got my show, people laughed at me and said, "You're not going to make it." And I can't tell you enough how being in the Marines, getting a mission, making sure you never fail, running through that brick wall, and just being so disciplined. Being in the Marine Corps, but listen, man, I've made my mistakes as an adult, but everybody makes mistakes. But when you make a mistake, you pull out of it. You realize, hey, I cannot do that again. I need to do the things that are going to make me successful. So that all goes back to being a Marine.
Well, Steve, for people who didn't serve in the military, what do you think that they should know about what it's like doing this for your country?
Well, it's a huge sacrifice. when I was in the Marine Corps, I wasn't married, but there was large stretches of time where I served overseas, and you're not with your family. And back then there was no computers and email and Skype and all these type of things. So you wrote letters, and my kids will never know the feeling of getting a letter in the mail from your parents or one of my siblings. What a joyous occasion that was for me when I was in the military. So being in the military it's a huge sacrifice. You're certainly not in it for any financial gain, but I really respect the people that do it. One, all my uncles were in the military. My father was a paratrooper in the Korean War. Listen, and I appreciate that. Like somebody like you says, thank you for your service. I loved it. I mean, I actually loved being in the Marine Corps. I wanted to make it a career. It didn't work out that way for me. Some other opportunities opened up. But I spent 6.5 years in the Marine Corps, and I enjoyed it. I loved it. I loved the discipline of it. I loved the camaraderie. It was the best experience of my life. And let me tell you something. It feels like 100 years ago. I've had 5 different lives between then and now, but that will always stay with me. That carries with me, and the Marine Corps lives within me.
Well, Steve, I want to thank you very much for your time today. Please give your best to your wife for us. We're all pulling for her, and thank you very much.
Hey, thank you.
We'll be right back right after this. Every day at 4 a.m., DCW 50 broadcasts our national anthem. As a tribute to our veterans, we close our show with one of our selections. I'm Bramante Bryant. Thanks for joining us, and don't forget to thank a veteran.
Twilight's last gleaming, whose broad stripes and bright stars through the perilous fight, o'er the